Epilepsy is a chronic disorder of the central nervous system that results in abnormal electrical activity in the brain, leading to recurrent and unexpected seizures. These seizures can vary from simple, involving mild movements and tremors, to severe, leading to loss of consciousness and violent convulsions. Epilepsy can affect individuals of all ages, but some cases may start in childhood or among the elderly. Causes of epilepsy. Epilepsy doesn't always have a clear cause, but several factors can contribute to its occurrence, including 1. Genetic factors. Some types of epilepsy may be linked to genetics, with an increased chance of occurrence if there is a family history of epilepsy. 2. Brain injuries. Severe head injuries, such as those from accidents, can lead to epilepsy due to damage to brain cells. 3. Infections of the nervous system. Conditions like meningitis or encephalitis can affect brain function and increase the risk of epilepsy. 4. Stroke. Strokes can lead to a lack of oxygen to the brain, increasing the likelihood of developing epilepsy. 5. Developmental disorders. Conditions such as cerebral palsy and autism may be associated with epilepsy. Types of epilepsy. Epilepsy is divided into two main types. 1. Focal or partial epilepsy. This type begins in a specific area of the brain and may remain confined there or spread. Symptoms may include involuntary movements, unusual sensations, or changes in perception. 2. Generalized epilepsy. This type involves both sides of the brain and often leads to loss of consciousness. It can manifest in several forms, such as absence seizures, staring blankly for a few seconds, or tonic-clonic seizures, violent convulsions. Symptoms of epilepsy. Symptoms vary based on the type of seizure, including muscle convulsions, involuntary movements of the limbs, loss of consciousness for either short or long periods, staring blankly during absence seizures, unusual eye or facial movements, sensory disturbances, such as unusual smells or hearing non-existent sounds. Treatment of epilepsy. Epilepsy can be effectively treated with a variety of options, including 1. Anti-epileptic drugs. These are the first line of treatment and work to reduce abnormal brain activity. There are many types that vary depending on the seizure type and patient's age. 2. Surgery. In cases that do not respond to medication, surgery may be an option to remove the affected area of the brain causing the seizures. 3. Vagus nerve stimulation. A device is implanted under the skin to send electrical pulses to the vagus nerve, helping to reduce seizures. 4. Ketogenic diet. Especially for children, this high-fat, low-carbohydrate diet may help reduce seizures. Living with epilepsy. Epilepsy patients can live normally by following some tips. Adhering to medication. Take medications regularly as directed by a doctor. Maintaining a healthy lifestyle. Avoid fatigue and lack of sleep, and stay away from stress and tensions. Awareness and precautions. Avoid places or activities that may be dangerous during seizures, such as swimming or driving without medical clearance. Epilepsy is a controllable condition in most cases, and those affected can lead a normal life by following the appropriate treatment and avoiding known triggers.